Good evening, myself Dr. Nikita Rupareliya, tutor in pathology. Today we are taking a practical of Introduction Hematology, Blood Collection and Anticoagulant. Competency of the today's practical is describe the role of the anticoagulant in the hematology. Learning objective of practical is first collection of the blood, site selection for the blood collection, method of the blood collection, equipment required for the collection, types of the vacuotainer or bulbs, and order of draw. So first we will start with the blood collection. The aim of the blood collection is it is collected for the various hematological investigation. The blood sample can be obtained from the various sites. First is skin puncture, second venipuncture, and third is arterial blood. So skin puncture from in the adult and children we are taking the blood by skin puncture from the finger or earlobes, and in infant we do it by a great toe and heel. For the venipuncture we use the vein of the arms, medial cubital vein and cephalic vein. And for the arterial blood, we collect it from the radial artery, femoral artery, brachial artery, scalp artery in the infant, catheterization of the umbilical artery in the neonate up to 48 hours. So we see one by one in the detail. First is skin puncture. The indication is for the RBC count, total leukocyte count, differential leukocyte count, hemoglobin estimation, peripheral smear making, blood grouping ESR, microhematocrit, and for the microanalysis of the blood by the automation or enzyme strip. Advantage of this method is it easy and simple. Disadvantage is hemoglobin, RBC count and PCV count may be significantly lower than that from the venous blood. Second is not enough quantity of the blood is obtained from the skin puncture. And third is collection by the squeezing may give the enormous result. Now performance of the finger stick method. The best location for the finger stick are the third and fourth finger of the non-dominant hand. Do not use the tip of the finger or the center of the finger, and avoid the extreme sides of the finger where there is a less soft tissue, where vessels and the nerve are located, and where the bone is closer to the surface. So we don't use the extreme side of the fingers. Second finger tends to have a thicker skin, so we don't use this. And the fifth finger tends to have a less soft tissue overlying the bone, so we also don't use fifth finger. And avoid the puncturing a finger that is a cold, cyanotic, swollen, scarred or covered with any rash. So this is the site for the skin puncturing, middle finger or ring finger. Using a sterile Lensen, make a skin puncture by just away the center of the finger pad. The puncture should be made perpendicular to the ridge of the fingertip so that a drop of the blood does not run out the ridges. Wipe away the first drop of the blood, which tends to contain the excess tissue fluid. Collect the drop of the blood into the blood collection device by gently massaging the finger, and avoid the excessive pressure that may squeeze tissue fluid into the drop of the blood. Now blood connection in babies. The pre-warming of the infant heel 42 degree for a 3 to 5 minutes is important. Clean the site to be punctured with the alcohol sponge. Dry the clean area with the dry cotton sponge, and hold the baby's foot firmly to avoid any sudden movement. Do not use the central portion of the heel because it may injure the underlying bone and which is close to the skin surface. Do not use the previously punctured site. Make a cut across the heel print lines so that a drop of the blood can well up and not run down along the lines. The recommended location for the blood collection on a newborn baby or the infant is the heel. The diagram below they indicate a green the proper area to use for the heel puncture for the blood collection. This green area is used for the collection. So this side we can collect the blood from the toe also. Now second most commonly we use the method is a venous blood collection, venipuncture. First we will see the method. First identify the patient, check the requisition form for the requested test, patient information and any special requirement. Select a suitable vein for the puncture. Clean the venipuncture site with a 70% alcohol or iodine or a spirit. Allow the area to dry. Apply the tourniquet several inches above the puncture site. Anchor the vein firmly both above and below the puncture site by using a thumb and middle or index finger. Instruct the patient to clench his or her fist. Perform the venipuncture. Enter the needle to the skin at the 15-degree angle to the arm with the bevel of the needle upwards. Collect the sample in the appropriate container. Recognize the complication associated with the phlebotomy procedure. Then assess the need for the recollection of the sample or rejection. Mix and label the collected tubes at the bedside or drawing area. Promptly send the specimen with the requisition to the laboratory. Now labeling of the sample is very important. First see the patient's name, first name, middle name, last name. Then ID number. Note the both of the above must match the same on the requisition form. Date, time and initials of the phlebotomist must be on the label of the each tubes. Now what are the indications for the venous blood collection? First, when we want to give any intravenous therapy, any venous blood collection, treatment of the certain disease like a hemochromatosis, or when we want to give the parenteral nutrition. Now what is the common site for the venipuncture? Commonly we use the veins of the arm. The cephalic is shown in the figure, cephalic vein, basilic vein and medial cubital vein. But mostly we prefer the median cubital vein because it is a larger, easily visible and best uncut vein and it is a more stationary. So we commonly do the blood collection from the median cubital vein. So this is all about the collection. After the collection, we loosen the tourniquet immediately. Then apply the cotton to the puncture site. Now the needle should be inserted in the direction of the vein. So as shown in the first figure. Second figure shows the wrong method. The needle is entering with the angle in the vein, so we can't collect the blood and it forms the hematoma. This we have shown with the needle and the syringe. The second method is a collection with the holder. In the venipuncture technique using the evacuated container. So in this, the specialized needle is available. So distal end of the needle has been screwed into the holder. The yellow is shown is the holder and the proximal needle has to be unsheathed and inserted into the suitable vein. And then evacuated container has been inserted into the holder, forced into the sharp end of the needle. The blood is collected automatically in the vacuum according to the vacuum. This is the same method, holder, tube and the needle with a bevel tip. The advantage of the venipuncture is we can collect the large amount of the blood and less chance of the bleeding than the arterial route. Now there are various complications associated with the venipuncture. First is the hematoma formation. If the hematoma is, we can prevent it by release the tourniquet before the needle is withdrawn and use the major superficial vein. Make sure the needle fully penetrates the uppermost wall of the vein. Partial penetration may allow the blood to leak into the soft tissue surrounding the vein by way up to the needle bevel. And if the hematoma is already formed, apply sufficient pressure over it and let it dissolve. Second complication is dizziness. Make the patient lie down, elevate his legs above the ground level. Now third is vomiting. Fourth is continuous bleeding can be happen, and last is a failure to obtain the blood. Other complication can be hemolysis of the blood. So to prevent the hemolysis, deliver the blood gently and mix the tube with the anticoagulant additive gently 5 to 10 times. Avoid the drawing blood from the hematoma. Avoid the drawing the plunger back too forcefully if using the needle and the syringe. Do not use the fine needle. Avoid the frothing of the sample. Make sure the venipuncture site is dry. Avoid the probing must and traumatic venipuncture. Sometimes the blood won't flow in from the needle. There are various reasons for it. The tip of the needle may not yet be within the vein, may have already passed through the vein, may have missed the vein entirely, or may be pushed up against the inside the wall of the vein. So, in the first condition, if needle do not reach up to the vein, move forward the needle. If the needle has passed through the vein, move backward the needle. If the hematoma is formed, we have to withdraw the needle and apply the pressure. The same condition, adjust the angle of the needle, and if the needle is too big, withdraw and pressure for the 5 minutes if it reached up to the artery, and loosen the tourniquet. Now there is a hemoconcentration. An increased concentration of a larger molecule and formed element in the blood may be due to the several factors. Prolonged tourniquet application. So, tourniquet should not be applied more than 2 minutes. Vigorous massage, squeezing and probing can cause the hemoconcentration. Large term IV therapy also can cause the hemoconcentration, and sclerosed or occluded vein. Now the third method is the arterial blood method. We have seen the site of femoral artery, brachial artery, radial artery. We can collect the blood from these arteries. The indication for the arterial blood is to measure the O2 tension, measure the CO2 tension, patient with lung disease, prolonged O2 therapy, mechanical ventilation, critically ill cardiovascular patient, patient undergoing the cardiac or pulmonary surgery. In this condition, we have to collect the arterial blood. The method is the same as for the venipuncture, but the site is different. Now, what are the equipment we need for the blood collection? First is a needle. Needle has a number. It's called gauge number. The smaller the gauge number, indicate the larger outer diameter. In this figure, we can see the number of the needle: 26G, 27G, 25, 24, 23, 20, 21, 22 and the 18. The smaller the number, larger the outer diameter. Second is a syringe. Then cotton, alcohol, tourniquet, collection tubes, adhesive bandage, gloves and the sharp box. We need these items for the collection. In the photo we can see tourniquet, gauge, holder with a safety needle, vacuum collection tube, bandage, alcohol swab. Now first we will see the syringe. These are the part of the syringe. We attach the needle at the nozzle of the syringe. needle, hub of the needle, then the barrel of the syringe and the plunger. The syringe have a various type. According to the amount, 1 ml, 2 ml, 5 ml, 10 ml, 50 ml capacity needle is available. Now, what is the characteristic of the ideal needle? There should not be any leak in the syringe. Fill the 2 to 3 cc of the air in the syringe, block the nozzle with the finger, and then pull and leave the piston. Piston, after leaving free, should come to the original place in the ideal syringe. Hold the syringe vertically and the piston should not be fall down. Join with a needle hub should be alright. Marking should be clearly visible. Piston should not be too tight and the double calibration to be avoided. Now the needle. The part of the needle is first bevel, then the shaft of the needle, and the hub of the needle and the number of the needle written on the hub of the needle. It is the gauge number of the needle. Now type of the needle is there are 3 types. Steel needle rusts early, so not used often depart. Then stainless steel needle is ideal needle. Then plutonium needle. It is a long standing and expensive. Second is a disposable needle with a plastic hub. The size of the needle is known by the thickness of its body. Example, gauge number 15 to 24. Lower the gauge, thicker the needle. Short needle is used for the intradermal and subcutaneous injection, for water injection. Long needle used for the intramuscular injection and used for the viscous fluid. Blood donation needle hub is flattened anteroposteriorly. Uses. The different site have a different gauge number. For the intradermal injection, we use number 26. For the subcutaneous injection, we use 24 number needle. For intramuscular injection, 22 to 24 number. For the IV injection collection, we use 22 to 28 number needle. Blood banking needle is thicker, so we use the 16 number needle. And for the aspiration, the thick fluid, we use the even larger needle, number 12 to 14. 21 or 22 gauge needle used in the adult and 23 gauge needle used in the children. Then characteristic of the ideal needle. It should be patent, should not be blocked. It should have a smooth surface with a no bend in the body. It should be rustless. Its fitting with a needle should be alright. Bevel should be sharp and not bent. The bevel should not catch the cotton fiber when rubbed on the cotton. This is the characteristic of the ideal needle. Now, next topic is anticoagulant. Now, blood is withdrawn from the patient and is mixed with an anticoagulant to prevent a coagulation. So, main purpose of the anticoagulant is to prevent the coagulation of the blood. It is anticoagulant used for the hematological investigation are most common is EDTA, ethylene diamine tetraacetic acid, heparin, double oxalate, trisodium citrate. So, anticoagulant are mainly classified into 2 types, chelating agent, non-chelating agent. We will see one by one. First, in the chelating agent, single oxalate contains a potassium oxalate. The mechanism of the action is chelation of the calcium ion, so named chelating agent. The concentration is required is 2 to 3 milligram per ml of the blood is required, and it is used for the estimation of the blood urea, non-protein nitrogen and plasma fibrinogen, etc. Second is double oxalate in the Winthrop's bulb. In this content is the ammonium oxalate 3 part and the potassium oxalate 2 part. It prevents the coagulation and maintains a morphology nearly normal. The mechanism action is the same by chelation. 2 mg per ml of the blood is required and it used for the certain hematological investigation. Examples: RBC count, hemoglobin, a total leukocyte count, differential leukocyte count, ESR by the Wintrop's method, PCV, blood grouping, ABO blood grouping and RH blood grouping. Now third most commonly used is a ethylene diamine tetraacetic acid, EDTA. It is generally available as a sodium dipotassium or dipotassium salt of the ethylene diamine tetraacetic acid. The concentration of 1.5 mg per ml of the blood is required. Dried form of the anticoagulant is used as it avoids the dilution of the sample. In the excess concentration like a 2 mg per ml causes the shrinkage of the red cell and degenerative changes in the red cell or white cell and decrease in the hematocrit and increase in the MCHC, mean corpuscular hemoglobin concentration. Excess of the EDTA also causes the swelling and the fragmentation of the platelet, which tends to enormously high platelet count. Now uses of the EDTA. There are different color for the different vacutainer. So EDTA has a purple color. It is used for the complete blood count, blood smear examination, hemoglobin electrophoresis, sickling test, reticulocyte count. Now fourth is a fluoride. The content of the fluoride anticoagulant is a potassium oxalate plus sodium fluoride. The sodium fluoride is used in the concentration of the 2.5 mg per ml of the blood and used for the glucose estimation. Sodium fluoride maintains a stable glucose level by inhibiting the glycolysis. Fluoride vacuity has a grey color. You can see in the photograph. Now last is a sodium citrate. It contains a trisodium citrate solution and the acid citrate dextrose solution. The concentration of 1/9 whole blood is used for the coagulation study and the 1/4 for the ESR estimation by the Westergren method. Sodium citrate prevents the coagulation by binding the calcium of the blood in a soluble complex. It is a part of the acid citrate dextrose solution and the CPD citrate phosphate dextrose solution are used for the blood collection, storage and of the blood for the purpose of the transfusion. So is used in the blood bank. The sodium citrate vacuity is a light blue color. We can see in the photograph. Now in the non-chelating agent, there is a heparin anticoagulant. It is used in the concentration of the 15 to 30 units per ml of the whole blood. It may cause the clumping of the platelet and white cell. Coagulation is prevented by the interaction with the antithrombin 3 and the subsequent inhibition of the thrombin. So, blood clotting is prevented. It is used for the osmotic fragility testing and immunophenotyping. Heparin vacuity has a green color. You can see in the photograph. Now plain tube, the serum separating tube. It is without any anticoagulant and it is available as a red color vacuity. It is used for the test biochemistry, all the biochemistry tests, liver function test, renal function test, calcium, lipid profile, electrolyte, hormones and the serum osmolality. Now for the collection, the vacutainer, two things is available, vacutainer and the bulb. So vacutainer is a stoppered tubes, vacutainer evacuated collection tubes. The most common system includes the tubes of the various size with a color coded top indicating the tube's content. The tubes all have an additive except the red one. Additive includes the anticoagulant and the clot activator. Each test requires the specific tube using with the specific additive. This is a bulbs. It was previously used and now it is outdated. In this, the bulb is available and we have to add the anticoagulant solution. So now it is not used. Now anticoagulants and the preservative for the blood products. So in the blood bank, we collect the blood and we have to store. So we are using the different anticoagulant in the different concentration and amount for the blood collection bags. So to ensure the viability and stability of the product, we use the anticoagulant. Second, to inhibit the microorganism. Third, to prevent the clotting of the product. Now red cell anticoagulant and its preservation. The first is a citrate. Calcium chelating agent prevents the coagulation by interfering with the calcium dependent step in the coagulation cascade. Second is citrate dextrose. The dextrose provides a nutrient for the red cell and support the generation of the ATP by the glycolysis, thus enhancing the red cell viability and extending the shelf life. Third is citrate phosphate dextrose. Phosphate maintains the pH. Alkaline pH helps in maintaining the 2,3-DPG. The shelf life is extended to the 28 days. The CPD is not commonly used now. Now next is a citrate phosphate dextrose adenine, CPDA. The addition of the adenine is associated with the improved synthesis of the ATP, allowing the larger shelf life from the 28 days to 35 days. Other solution is a Adson or AS1, Nutricel or AS3 or Optiso is AS5. And Segum, currently used anticoagulant in the blood bank, is a Segum, saline, adenine, glucose and mannitol. After taking the blood donation in the CPD and separating the red cell from the plasma and platelet, Segum is added to the packed cell. The resulting red cell have a flow characteristic equivalent to the plasma, reduce the blood and the storage life of the 35 to 42 days. The other advantage is by removing the maximum amount of the plasma from the blood for the manufacture of the factor 8 and albumin. Now last is the order of filling the tube. When we collect the blood, the filling of the vacuity is very important. We will get a various taste and we have to collect the different vacuity for the different tasting. So the order of the draw is very important. Following order at the filling of the tube should be followed after withdrawal of the blood from the patient if the multiple investigations are ordered. First tube should be filled as a blood culture to prevent any contamination. Second tube is a plain tube because we don't add any anticoagulant to this tube. So second tube is plain tube. Third tube is a tube containing anticoagulants like EDTA, citrate or heparin. And the fourth tube is tube containing the additional stabilizing agent like a fluoride. So this is the order of the draw of the tubes. So this is a very important practical. You will ask the uses of the vacuity, order of the drawn of the tube in your table viva, and also in the spotting. You can ask the identify vacuity, name the content of the anticoagulant, uses of the vacuity. So it is a very important. You will surely get in the table viva all this is bulbs. Thank you.